Bad breath, also known as halitosis, can be caused by a variety of factors. Here are some common causes and potential solutions. 1. Poor oral hygiene. Neglecting proper dental care can lead to the buildup of plaque, bacteria, and food particles in your mouth, which can cause bad breath. Solution: brush your teeth at least twice a day, floss daily, and use a tongue scraper to remove bacteria from your tongue. Regular dental checkups and cleanings are also essential to maintaining good oral health. 2. Food and drink. Certain foods, such as onions, garlic, and spicy foods, can leave a lingering odor in your mouth. Coffee, alcohol, and tobacco can contribute to bad breath. Solution: avoid or minimize the consumption of foods and drinks that cause bad breath. If you do indulge, be sure to brush and rinse your mouth afterward. 3. Dry mouth. Saliva plays a crucial role in cleaning your mouth and neutralizing bacteria. A lack of saliva can lead to bad breath. Solution: stay hydrated by drinking plenty of water. Chewing sugar-free gum or sucking on sugar-free candies can also stimulate saliva production. If dry mouth persists, consult a healthcare professional for potential underlying causes and treatments. 4. Poorly fitting dental appliances. Dentures or dental braces that are not cleaned properly can trap food particles and bacteria, leading to bad breath. Solution: ensure that you clean and maintain your dental appliances as recommended by your dentist. Regularly check with your dentist for adjustments or replacements if needed. 5. Gum disease and dental problems. Gum infections and dental issues like cavities can create a foul odor in your mouth. Solution: schedule regular dental checkups to detect and treat any dental problems promptly. Follow your dentist's advice for treatment and maintenance. 6. Sinus and respiratory infections. Infections in your sinuses or respiratory tract can lead to bad breath. Solution: seek medical attention if you suspect a sinus or respiratory infection. Treating the underlying condition should help improve your breath. 7. Medical conditions. In some cases, bad breath can be a symptom of underlying medical conditions, such as gastrointestinal issues, liver problems, or diabetes. Solution: if you have persistent bad breath despite maintaining good oral hygiene, consult a healthcare professional to rule out any underlying medical issues. Remember that these solutions are general recommendations, and the effectiveness may vary from person to person depending on the root cause of bad breath. If you're concerned about your bad breath, it's best to consult with a dentist or healthcare professional for a personalized assessment and appropriate treatment. Thanks for watching.